Hey there, welcome back to another unhinged episode of Healing Hormones and Holy Shit, where your hosts are besties joining you from opposite sides of the country. How you doing, Gina?
I'm doing good. How are you?
I'm good. Well, I think today we're going to do something a little bit different. Being in midlife, sometimes we have to deal with stuff that we don't necessarily want to deal with. And part of that is dealing with our aging parents. And we both
Huh.
have dads that are about the same age, going through some of the same stuff. And I know my dad is not quite dealing with the same stuff that your dad's dealing with, but both are dealing with different illnesses in different phases. My
Uh-huh.
dad dealing with kidney cancer, advanced diabetes. He can't get around by himself anymore, no longer drives, stuff like that. Your dad, however, is dealing with a little more advanced stuff.
Well, definitely advancing stuff.
Mhm.
Um, he has Parkinson's and he's now entering into stage 5, which is the final stage. He wasn't really even diagnosed until late stage 2, early stage 3. It was overlooked.
Right.
So, navigating the healthcare system. I know that you're not a proxy for your dad at this
Right.
time.
Right.
Being the proxy, I mean, I've had to advocate for myself in recent years, but when you're advocating for someone else, it's a whole new level. A whole new level of hell, a whole new level of bureaucracy,
Yeah.
specifically when you start getting involved with, the VA healthcare system, Medicare, all of these things that, we're just now getting our AARP cards in the mail and we're still years away from, having to navigate the Medicare system, let alone having to deal with VA. I mean, and I have to say, at least here in Arizona, I know the VA gets a hell of a rap. At least here in Arizona, they have been phenomenal.
They have. And that's something that's been really good for my dad because my dad lives out there just a mile from your house. So
Right.
our dads both being veterans, the VA has been phenomenal for both of them. That is a blessing.
I honestly, at this stage of the game, I'd be lost without the VA. They have helped so much because my dad, most people do not know the story. Back in, uh, and we'll try a concise summary here. Back in April of 2022, my stepmother passed away, which left my dad home alone. Something he did not do. My dad didn't life by himself. He was married to my mom for 24 years and then very shortly after that divorce, remarried and then was married for 25 years. So he hasn't lifed on his own in that regard. So when he was left to his own devices, I'd gone out there for a couple of weeks. I had to set up her entire funeral, do all of those things because he mentally checked out of the building. Like the body was there, the brain was gone. That was that. And so when I left, he was using a cane sometimes. He should have been using a cane all of the time, but older Italian male full of ego and pride, he wasn't going to listen to anybody's advice, instructions, whatever. So fast forward until, and this is kind of where things started getting dicey. In February of, well, let me back up. I want to get my time straight. Oh, so the year prior to my stepmom passing, he had given me a call and it was right before his birthday and he'd had a car accident. At least I think it was before she passed. At this point, I don't fucking know. I'm going to be honest. I don't remember when this call came through, but I don't think my stepmother was still around. But it couldn't have been, I don't know. I really don't know. So anyway, he'd had a car accident. Whenever this took place, he'd had a car accident and I'd already been wondering if he needed to be driving or not.
Right.
So I went back home after my stepmom passed. I was in Ohio for 2 weeks. And then after that, the phone calls, I was getting called just about every day with something, be it a recipe, be it what he did, be it just whatever. He was calling all the time. And I noticed, he would start making different statements. I fell. or I almost fell. And I'm like, Dad, you need to go to a doctor. Like, I'm across the country. I can't just get in my car and show up at your front door in 15 minutes or less. So that kept going. He did end up going and seeing a specialist. And then he went to some sort of PT to help with his balance. Okay. So we'll fast forward. He was being seen for that. His primary care was aware. Nobody's red flagging anything at this point. Come February of 2024. Okay, so the car accident happened in 2023. Come February of 2024, I get a phone call. It's him. He's talking out of his head. And I just talked to him the day before. Now, the falls had been getting, more frequent. All of these things had been happening. He was in touch with doctors. I didn't know what else I could do. We put safeguards in place, put a external keypad on his garage to be able to bypass the key entry of the building that he lived in. I told him, don't lock your door, your condo door, because in case somebody needs to come in and help you, we don't want your door getting knocked down. So anyway, he called me completely out of his mind, telling me some story about how his girlfriend had come over. Yeah, that's another story, but his girlfriend had come over and was messing with him, and he was pissed off, and she kept going from room to room, like hiding from him, and he was trying to find her. And then he saw himself and his ex-wife, or not ex-wife, but my deceased stepmom, dancing in the bedroom. And then he tells me that he called his girlfriend's daughter and, told her all about what had happened with her mom. I'm thinking, okay, something ain't right in Denmark. Something is not right. And I told him,
Right.
I said, let me get off the phone with you. Let me make a couple of calls. I'll get right back to you. Don't put your phone down. Because at this point, I don't know what he's doing, where he's at, mentally or physically. So I called the girlfriend's daughter through Messenger on Facebook, and I said, hey, did my dad call you? And yes, he had in fact called her and in fact gone through this whole gamut with her. And we were like, okay, something really is not right here. Now, mind you, his girlfriend is around his age. She can't drive at night. He certainly couldn't drive at night. I knew she didn't show up at the house. Plus, there was a snowstorm. So that was like confirmation number 2 that wasn't even necessary. But I knew for damn good and well she did not show up at the house. So just so happens the girlfriend's daughter is a nurse. She's like, I'm going to go over and check on your dad. Thank you, because I'm over 1,000 miles away. What am I going to do? So she goes over. I gave her the entry for the garage so she could bypass the front door intercom or the key. And then fortunately he listened, left the front door open. She walked in, immediately figured out what was going on just by the smell. And that's hard to even say. Place is a mess. So I don't know how long he'd been fighting this off. It turned out he was hospitalized with a very severe UTI.
Wow.
And yeah, so I didn't know what all was entailed. I just knew he was not in his mental faculties at that point. And the fact that he was
Yeah.
admitted to the hospital, I got on a plane. 3 hours later, I'm on a plane with 3 days of clothes suitable for Arizona weather, flying into Ohio where there's snow and ice and freezing cold temperatures. So nonetheless, get to the hospital. He's out of it. He's not able to do anything. He's talking to dead people when he is awake. Other than that, he's sleeping, infection driven, whatever. And so this went on for about a week. He was in the hospital. That's when I really got to see he's not able to walk now. He's not able to toilet himself now. He's not barely able to sit up unassisted. When they discharged him from the hospital, they sent him to a care facility for rehab. In the meantime, I'm still in Ohio cleaning up the condo, trying to make sure he's getting the proper medical care. And with all of that, he had a referral for a neurology and urology. Take him to the neurologist. I don't know why these people are in practice. At least this one. affiliated with the hospital he was in. They wanted to check his, nerves and whatever else. So they did the nerve testing on him. Fast forward, they concluded it was mild neuropathy. He gets down out of the chair. Nobody, this is a neurologist's office. No one is paying attention to the tremor in his hand while he's sitting there. No one is paying attention to his shuffling gait when he gets up and gets to his walker. No red flags are going off in anybody's head, but apparently mine. I'm flying solo here. End result, he could no longer live alone, had to sell his house, sell his car, moved him out to Arizona. In Arizona, and in fact, I took him to the neurologist that you yourself see or had seen.
Yep. Yep. Good doctor.
Within 5.5 months of being here, we'd set up VA, which was good. He had physical therapy, occupational therapy, got some home health caregiving hours to assist with showering, things of that nature. He got his diagnosis of Parkinson's. And the crazy thing about it is the very things that I'm flagging to these doctors in Ohio and pointing out and saying, this shouldn't be this, I'm over here playing Dr. Google trying to piece two and two together to find out what's wrong with my dad. And sure enough, just based off of, other testing, but physically seeing my dad, the main markers for this doctor were his tremor and his shuffling gait when he was walking. In the wrong fucking line of work. I
Yeah.
should have just, at least a nurse, something. I don't know. But nonetheless, moved him in, and I have been caring for him solo now since August.
Right.
It's not pretty. He's declined. He's declined quite. You've seen him.
Yeah, he has. He's declined quite a bit.
Yeah.
And, it takes a toll on him as the patient, as the
Hmm.
parent. It takes a toll on you as the caregiver, as the child. I know from a distance, living across the country, or even when I was living in the same state as my father, living a mile away, watching my father decline when I
Hmm.
wasn't in the same house, when I'm not even his caretaker, watching my father tick away,
Hmm.
worrying about, like his upcoming surgery. He's going to have his kidney removed, and knowing really it's a crapshoot whether or not he's going to make it out of that surgery alive. As the midlifers, as us Gen Xers, we sit there and we're at that crossroads of we're either taking care of our parents or we're worrying about our parents.
Hmm. Yeah.
And if we're lucky enough to have our parents out there and they're halfway healthy, hell yeah, that's an amazing place to be in. But a lot of us
Right.
are in the same situation that we are, where we're either worrying about our parents, we have people taking care of our parents, either at home or in a care facility, or we no longer have them with us. And it is that crossroads that at our age that we are at, that this is what we're facing in life,
Hmm.
you know? And we can take joy in some of the lighter moments though, is the
You
nice thing about
can.
it, because your dad is a cool guy at moments.
He
He is
has
funny.
his moment. Yeah. Yeah.
Your dad and my dad are both Italian veterans, and they
Hmm.
have their quirks and they have their
But
funny moments. We joked about, I think in our last podcast, the screaming goat in the background that I think
uh,
both your father and my father fit into that sound. My dad's always got the TV on full blast and there's a Western going or something. I forget what my dad loves the Westerns and is always blaring the Westerns. That's his little quirk. He's got to have things up at like 1,000 volume on his TV. And I think when I lived with him, he watched, I swear to all that is holy, every possible Western ever made that they show on the Western Channel. I've probably
Probably.
watched them all twice. What is your dad's quirk?
Well,
Like that would be
there's
comparable.
many more than just one, however, and this is something that I recently had to put a stop to. His thing was always true crime or whatever could possibly have to do with death, dying, or murder. And we've
Well,
recently figured out that, and he hadn't watched any TV probably in over 2 months,
okay.
like no TV. but I've had to put him on daily time blocks. It's the
Yeah.
only way that he knows what to expect and
Like a
he's very
schedule. Yeah.
time yes, he's very time oriented. That's one of his fixations. So, if permitted, he would have his watch on 24/7. Now, to the average person, that's not an issue. To my dad, it is because it's almost like an OCD compulsion.
Right.
So he now only gets the watch if we're leaving the house, kind of like as an accessory instead
Right.
of it being just because he cannot handle it in the way that anyone else would handle a timepiece. So I had to put everything into the block and trying to keep him from the hyperfixations on different things, whether it be the time, whether it be trying to Google every symptom known to mankind and coming up with random ass diseases that he does not have, but telling then everybody that he has them because he had a symptom. And of course, he picks the most hideous of the
Of course.
potentials within
Of
there.
course.
I mean, he woke up today and he now has a hernia. He doesn't have a hernia, but I don't even know where he pulled that one from. So, he'll go on about diarrhea. He'll go on about his bathroom habits. He'll go on about everything. So I was like, okay, well, we need to break this day into blocks. You have certain activities that you focus on between this time and this time. Be it a
Yeah.
book, crossword puzzle, word search, whatever. And, his caregiver typically will come from like 9 to noon. Or if I add rest hours, today I had from 9 a.m. and I've got until 6 p.m. So that's
Right.
how I'm able to do this right now. I'm not in the house,
Right.
but I had to reincorporate as a filler, essentially, some TV into his life. So that doesn't come without restrictions. I am not his favorite person.
No,
I
you're not
mean, I don't
supposed to
think
be.
I ever have been, but nonetheless, like
Well, regardless, you're not supposed to be. You're his
yeah,
caretaker first and
right,
foremost.
right. So, I choose the programming. He says, "Well, I may as well be in prison." I said, "Well, you may as well. I don't know what else to tell you. Like everything is for your own good. Everything is for your mental health, your physical safety. It's not pleasant, you
Right.
know. I have multiple different people telling me, "Go ahead and place them in a facility." I'm
Yeah,
not
I know
there
we've
yet.
talked about that.
Yes. I'm not there yet. I'm not saying, initially when I brought him out here, it was on a promise made by like a 6 to 7 year old child. I will always take care of you. Well, 6 or 7 year old child has no idea what that entails.
No,
No freaking clue. It goes way beyond a nurse's costume and a plastic doctor's kit,
that's right.
you know? But now here I am. And so, that the weight of that also adds too, because even when I brought him out here, like I was saying, full absolute intention of him remaining into the home until his final breath. Well, lots of shit has happened since I brought him out here. And we are now not in a larger home. We are now in a much, much smaller home. It is now just the two of us, essentially, on a day to day basis. Not that I anticipated my spouse at the time to take on caregiving for my dad. I did not. One thing she did, though, in the beginning was she did take a hands on approach. And that
Yeah.
did lessen a lot of the burden for me. It, helped traumatically or dramatically to have the caregiving on top of my spouse's help, and it made all the difference. Well, come August, when it was just the two of us, everything landed on me, and everything landed at the same time that he began the decline.
Yeah.
And whether or not the move and the stress of that whole situation accelerated the decline, it's possible. It's completely possible. But I can't say definitively. And I don't think a doctor would garner to say either. So, as we are now, he needs 24/7 surveillance. It's not just the way it used to be where, okay, while maybe leaving him for extended periods isn't a good idea, at least in the past, he could be left home alone for
Right.
even a few hours. No, no.
Yeah, not more than to walk out to the car and walk back. Yeah.
Right. And even walking the dog. One time walking the dog, which I'm viewers don't know this, but where I walk the dog is literally right behind the house.
Yeah.
He had already fallen.
Yeah. And it was
Why
bad.
why why he'd even attempted to get up, I don't know. But no, this was the fall in the bathroom.
This
I
wasn't the
don't even
table fall.
Oh, no, we aren't talking about the table fall. That's an entirely different ball of wax. And that day of the damn table fall, he had been falling more. So I'm kind of letting the viewers know. He had been falling more. And so it had gotten to the point where, he couldn't even get up from, say, his recliners right here, walk across the kitchen. Please don't ask why the recliner's in the kitchen. You would just have to know our circumstances. But
Y'all, it
anyway,
just makes sense.
yes, it does. It makes sense. Gives him his little space, and then I still have my little space. But the walk from his recliner to the sink to put a cup or, a piece of silverware, whatever, into the sink is nothing more than maybe 4 or 5 steps to me, to you, whatever. I don't know how he managed to, first of all, he knew he wasn't supposed to get up, but he still managed to fall. He got up sitting right I'm sitting right there. This wasn't even the table fall. This was when he fell in the kitchen. He just went, and it used to be that he would only fall backwards. Like there was no forward momentum, there was no side fall. It was just like all of a sudden something disconnected in his brain and he would just pitch straight back. How do you catch yourself when you're falling backwards?
You just
You don't.
don't.
You don't. Absolutely not. So you mentioned the table fall. I don't even know how that occurred. And his caregiver was there and I was there. Somehow, some way, just him getting out of the bed. I think that's what was going on. I honestly don't know. But all of a sudden, we just heard this huge crash and then him screaming bloody murder. Well, it didn't take long, and the size of our place doesn't prevent us from getting to him quickly. So we walk in, and there is just glass everywhere. From what he'd done is somehow managed to fall into tables recently brought by my ex that had belonged to my grandmother. We didn't have room for these damn tables, but he insisted that they be in the house. So I carved out a space and I put the tables there. And sure as shit, they hadn't even been in the house for 2.5 weeks. He fell into it. And this was the first fall that required calling 911 and a trip to the hospital. And I hope it's the
Yeah.
last. I hope it's the last because that
Me
could have
too.
gone extremely badly had he gotten impaled by any of that glass. Fortunately,
It would have
he,
been horrific. Yeah.
yes, fortunately, he did not get cut. He did, however, badly, badly, badly bruise his rib
He
cage.
bruised the snot out of himself. Yeah.
Oh, yeah, very badly. And so that was weeks. I mean, he still has discomfort from that, but we're going on a month since that had occurred. But it's, he's on blood thinners. He's on 2 blood thinners, not just one, but 2. If that glass would have gone into him, that would have been the end of him. He
Yeah.
would have likely bled out before an ambulance could have got there, before any type of clotting would have even decided to happen within his body.
Yeah, especially where he hit that table. Yeah.
Yes. So I have reconfigured and reconfigured the house. I've done things now, he doesn't get up without a gait belt and somebody holding on to him. Most of the time, he's put directly transferred from recliner into the
Yeah.
wheelchair
Here to
into
there,
the
here to
bed.
there.
Yeah. I mean, that's it. And he says, "Oh, I want to go here or I want to go there." And I tell him, "You're not going anywhere if it's not a doctor's office." The risk of getting him out of the house and into the car, because our circumstances do not allow for a ramp, we do not have the correct slope. He has to
It's just too
literally
much.
navigate 3 stairs, which isn't anything to most people. He can't do it. And so basically he's homebound, bed or chair bound. We've run the gamut, you know. I thought my days of changing diapers were over. They are not.
Nope.
They are absolutely not. You know, I know my dad on levels now that I would have been just fine surviving multiple lifetimes without knowing.
Yep.
I'd have been just fine, but no, you know, so it's tough. It's really tough. I'm again grateful for VA, grateful for, you know, his hours have been increased, unfortunately, because his needs have increased. So he does get more caregiving hours per week, you know, which gives me time to be able to get out of the house, to do some work, to
Yeah.
do, you know, whatever. Even if I just want to take a drive, I don't have to account for my time. I don't have to account for my space. Those are my hours, and I try my best to make the most of them.
Yeah.
Because when they're not there, when I do not have caregiving or I do not have respite, it is just me, my dad, the dog, and the cat. That is not conducive to mental health for
No.
either one of us. So again, I've had to
So, I
get
mean,
crafty.
I just have to just interject something in here. And you said a little something earlier, and I'm going to bring it kind of full circle in the moment
Okay.
that a lot of people give the VA a really bad rap. And I'm not saying that every VA office or hospital or clinic or whatever is the same in every state and every location
Right.
because they're not.
No.
It has a lot to do with the staffing and the funding and a lot of moving parts and gears, but the VA does get a bad rap. Absolutely, it gets a bad rap. The VA as a whole, however, when you do file your paperwork correctly
Mhm.
and you truly do have the disability and you truly do follow all the rules, I would say 75 to 80 or 85% of the time, you're going to get your benefits. You're going to get your care. You're going to be taken care of. You're going to get your respite hours. You're going to get your care hours. You're going to get your caregiver. You're going to get
Mhm.
what you need.
Yeah.
VA has taken care of our parents, our fathers, exceptionally well.
Yes.
They have
I
gotten their disability checks. They have gotten their caregivers. They have gotten their respite care. They have gotten their hospitals, their doctors, their clinics, their medications. They've
and
gotten
you
what they
know,
needed.
the crazy thing about this is that, you know, all of this time, my dad did not have a service connected disability.
Right. It took until just recently.
Nobody thought, and see, this is where my neurospicy brain comes in very good handy, because I started thinking about it. And, you know, my dad had been a dental tech in the Navy. No, he wasn't on a ship. Yeah, he didn't go anywhere outside of Florida. He was either in San Diego or Florida. But as a dental tech in the 1960s, what has been known to become a neurotoxin? And I'm not talking about fluoride. We all know that, well, majority of people know that fluoride is a neurotoxin, but I'm not going to go down that rabbit hole today. But he
I
was
don't know exactly
exposed.
what the name of it is, but there are a lot of things that dentists handle.
Yes. But
Yeah.
the mercury that my
Mercury.
dad
Thank
was
you.
exposed to, the vapors from the mercury, you know, growing up, one of the main things that I remember vividly is, you know, the glass thermometers. And they contained mercury back in the
Yes.
day. It was none of this digital bullshit or forehead
Yes.
stuff. It was, you either got it up the ass or you took it in the mouth. But either way, that thermometer had mercury in it. And I remember always being told,
Yeah.
if that's it, like, don't touch it, because they were breakable. They were glass. So, I mean, obviously the
Yeah. And we were
pretty.
always warned, don't break it open and touch yeah.
Right, right. You know, and when they did break, all that pretty glittery looking silver stuff would just bead up. And it just looked so tantalizing. You just want to touch it. At least I did. I didn't. But nonetheless, it started registering my brain. Wait a minute. Mercury, neurotoxin, Parkinson's. So I started doing some research, and there has not been a lot of research done in regards to mercury exposure and Parkinson's disease. contacted his social worker because he has an entire team. He has a doctor, he has a nurse, he has psychiatry, he has
Yeah.
social worker, he has all of these different people that come to the house. So
Yeah.
again,
Oh, yeah.
cannot sing enough praises. But I'd contacted his social worker and I said, hey, could this be something that we can look into even deeper? Getting him a service connection. So she comes over and we're looking through everything and she makes the calls and we're talking to this guy on the phone. And, he's like, well, we can try, but I really don't think that this is going to go anywhere. But if you gather information and then we can submit all of his medical records and everything else. But if you gather the information that links mercury exposure to Parkinson's disease, I'll at least submit it. Okay, well, let's add something else onto my plate. Now I'm a research assistant. And
Right. Of course.
I found whatever recent studies, I found whatever I possibly could that would remotely link his exposure to the Parkinson's. We'd submitted all of that, and the guy's basically telling me, don't hold your breath. Don't hold your breath.
Right.
This is like, he went through the whole appeals process. You'll likely have to go, if you decide to pursue it, go see an independent doctor and blah, blah, blah. So, like 3 months passed. I'm not thinking about it. It's last thing on my mind. Last thing on my mind, to be honest with you. And I get a call from his nurse, and she said, do you know that your dad got 80% service connection? Why, no. No, I did not. I did not. I get so many emails from VA, and I would probably say 98% of them are unnecessary. So majority of the time, I
Yeah.
have to say, I don't just click every one that comes in, because why? They're just going to end up going to the trash can. But yeah, so fortunately, apparently my little research paid off because this has
Yeah.
helped him a lot. It has given an increase of respite hours caregiving. Now, if or when I get to the point where, realistically speaking, it's not in his best interest, physically or mentally, to remain in the home, he now will go into a VA care facility. That service connection has put him to where he can be in a VA care facility. And that is a breath of fresh air, because otherwise it would have been a state facility. I mean, we are not the Rockefellers. And
Right.
even
Exactly.
some of the fancier facilities that you pay thousands upon $5,000-$6,000 a month for, they still have their problems. They're
Are
just
still not
packaged a
great.
little bit
Yeah.
prettier, you know. But I don't want to go there yet. I know how he was in the facility in Ohio. I know how that whole situation goes. And I just feel like if I were to do that, then I'd pretty much be signing his death certificate. And I'm figuring it this way: have things at a manageable level now. The changes that I've made within the home, the routine that I've set up, his caregiving hours, his respite hours, those are manageable at this point. I can manage
They are.
dad to the best of my ability within that framework without my physical health or my mental health suffering. As long as those two things remain true, I will keep him with me. I'm grateful for therapy.
Yeah.
I go
'Cause
at
I don't think
least
you could do it without it.
no, I go at least every 2 weeks. Um,
Yeah.
you need that outlet. And VA also
You do.
offers therapy for caregivers because it is taxing. You have no idea what you're signing on for when you take that route, because you've never lived it. You've never lived it. And
No,
you can even
nobody does.
no, and you can even be that could be your day job. And you could be accustomed to dealing with, the elderly and sick individuals for your paycheck. But when it comes to
But
a
not when
family
it's your
member,
family.
that's the key difference. That's the key difference. And my dad and I
Yeah.
have a very complicated history and backstory on top of it all. So it definitely, definitely has just been really shitty at times. I mean, it's rewarding in some aspects, but also when you have a history like my dad and I have, a lot of childhood trauma resurfaces, and you've got to be prepared
Yeah,
for that. Yeah.
you do.
So it's been a crapshoot. And for any of the viewers who are in a situation like mine, who are in Stephanie's situation where she's across the country and her dad's going through, health crisis back here. There are support systems out there. There are caregiving support groups,
Yes, there are.
be it through an organization or not through an organization. You can usually find them through, like different senior services. If you just call even AARP, they may have
Yeah,
resources
AARP is a
available.
good one.
Whatever what is it, 611, where they have all
Yep,
kinds of
611.
information. Yeah, just make sure
And
that
then there's
you
great
reach
little
out.
online things, like,
Mhm.
there's great apps like BetterHelp,
Yeah,
not sponsored, not endorsed, but,
right.
there are lots of great options out there.
There are.
Now if BetterHelp wants to sponsor us, we are all for it, if you're out there listening, but, we would love that. Um, plug, 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 check, check, check. But no, seriously though, there's a lot of great resources out there for everybody.
Yeah,
Um, and regardless of what your relationships is with your parents, whether good, bad, indifferent, in between,
right.
um,
An
it's
outlet
it's
is
it's a hard
so
road to
good.
walk.
Yeah,
Yeah.
yeah. It's
So,
one of
but
those
on
things.
that note,
Yeah,
yeah, on that note, thank you, Gina, for being so raw and open with everybody. I know it's helped somebody out there. And I know our audience appreciates us, even if it's just one person that we help every time we come on here.
right.
And so, anyway, I know this is a heavier episode for you guys, but stay tuned because we have those surprises that we promised you guys coming
Yes,
up very shortly.
and they will be
Keep
much
tuning
lighter in
in.
topic.
The next couple, yeah, guys, they're going to be a lot more fun for sure. Promises, we keep our promises. We always do. So keep tuning in, keep hitting that subscribe button, and we love you all. Have a fantastic day, morning, evening, whenever it is you are tuning in to watch our chaotic unhingedness. We love you.
Be easy.
And as Gina would say,
Be easy.
be easy.